Thank you, and good afternoon, everybody. Thank you for joining us here on this Friday afternoon. So once again, let me start with a few comments about the plans to gradually reduce restrictions in St. Louis City and in St. Louis County, scheduled to begin on May 18th. Now, I know the leaders in the city and the county have put a great deal of effort and thought into this process, and they've intended to do it in a very methodical way, and that's really important. And that's required a lot of collaboration between our elected officials and their staffs, public health, business, the healthcare system. Everybody has really come together to discuss what should this look like, and then how should we go about doing it. And it's been a very data-driven approach over the last 2 months for us to slow the spread of the virus and flatten the curve from the wave we experienced. And that allowed those conditions then so that the elected officials could feel more comfortable about relaxing some of those conditions and reopening the economy. And just as they have mentioned and as I have mentioned, we'll continue to look at that data all the way up until that reopening date and make sure that we still feel comfortable that this is the right thing to do and that we feel like the community is ready for it as well. But that leads us to another point. It's even more important now for us to continue doing all of those things that we've continued to do up until now, whether that's shelter in place, washing our hands, keeping surfaces clean. So again, with the whole goal of keeping that transmission rate as low as possible, because we know that once we start relaxing things, that it always is going to increase the risk of transmission. But if we can keep that low enough, we should be able to open up different parts of the economy. So let me talk a little bit again about the reproductive factor, and I've talked about this in the past, and this is going to continue to be important for us in staying ahead of any potential second wave. And so as you remember, when the virus first showed up in the St. Louis Metropolitan area, we believed that the reproductive factor was around 5, which means somebody that was infected could spread it to around 5 people. We believe that because of all of the shelter-in-place orders from our elected officials and then all of the other things that were put into place, hand washing, hand hygiene, face masks, all of those other things, that we've really dropped that down as a community down to around 1, which is really important. But we can't let up on that now. So that means we've significantly suppressed the spread of the virus, which is critical to reopening the economy. And we want to make sure that we don't go backwards. We always want to be in front of the curve, which means we need to be practicing all of these things that we have been doing while we go forward. But again, we'll keep an eye on the data to make sure that we are moving in the right direction even after we open the economy and all of those things have taken place, to make sure that we're doing all those right things. So let me talk a little bit now about our hospital admissions rolling average. So as you can see, we're still having an impact on this data from all of those things we've been putting in place to reduce spread. And again, this chart shows that the trend of our daily hospital admissions since early April, and it continues to go down. So back in early April, we were admitting as many as 60 patients a day that we either were confirmed or suspected of having COVID-19. And that rolling average has continued to fall steadily since early April, with a few upticks here and there. The data reported on this chart are lagged for about 2 days, and so as you can see, on Wednesday we admitted 33 new patients for COVID, and the rolling average is around 38, and so this trend again continues to go downward, and this is really what we want to see and what we'll continue to monitor going forward. And now I'll move to the slide that most people are very familiar with, and this is our hospitalization rolling average. And we remain encouraged by the flattening of our hospitalization numbers. The chart shows that our daily hospital census of COVID positive and suspected COVID patients, as well as the rolling average. And so as you can see, the April number that was rapidly climbing earlier in April, but today's rolling average is around 625, which is good. So it's starting to come down. And our current hospital census fell significantly from yesterday, from 596 to 506, and we hope that will continue and accelerate. The moving average fell as well from 646 to 625. And so, again, that's encouraging data that we're headed in the right direction, that all of those policy decisions that were made by elected officials, and then all of those other instruments that we put into place are really having an impact on spread, which is impacting hospital admissions. So this number has come down really significantly. It helps our hospitals then be prepared for any increase in cases that we might have going forward, keeps us from being overwhelmed, and it helps us then catch up with our PPE supply, with our testing supplies, all of those other things. Just helps us be better prepared in case we do see any increase in number of cases. So as we go forward, we want to make sure that we're taking a more targeted approach to identifying those positive cases and isolating them and stopping the spread in our high-risk communities, such as long-term care and other socioeconomic disadvantaged communities. And our healthcare systems will continue to work with public health, with our elected officials to support testing strategies across the metropolitan area, and looking to support primary care sites in underserved areas, ensure all that we can do to keep those transmission rates as low as we can. So here's the numbers for today. As I mentioned, we are at 506 hospitalizations from confirmed COVID and suspected COVID patients, which is really down significantly from 596 yesterday. And I believe, if I'm correct, that's probably our second lowest number since we started collecting all of our data. We have 133 confirmed COVID or suspected COVID patients in the ICU, which is down from 147 yesterday. So again, a nice decline in our ICU patients. And we have 104 confirmed COVID or suspected COVID patients on ventilators right now, which again is down from 106 yesterday. So all of our numbers are trending down, which is a good sign. And then our last data slide is, of course, the slide that we like to promote. It's 56 additional COVID patients were discharged from our hospitals yesterday, and that brings our cumulative total up to 1,609 since we first began tracking. So, and that's really all the credit goes to all those healthcare workers for helping take care of these patients and getting them better and making it possible for them to go home. So thank you to all of those healthcare heroes out there. So a couple of words now on the closing slide. We know that reopening the economy is not going to be easy and it's not going to be quick, but businesses and government officials and healthcare experts are all really working together to try and manage this process in a really smart, gradual, and safe way. And I'll just give a real quick shout out to some of the businesses too. They've come up with some really, really good plans on how they can reopen their businesses, and they've been very thoughtful about how they can best protect their workers, the customers, and everybody else in the region. And the reason for that is they want to do the right things for their customers and for their employees, and they also want to build confidence for people to re-engage in the economy. And so they've done some really outstanding work, and they should be congratulated for that. As I've said before, we have to continue to follow the data as we're making decisions, and this period of time up until the plan for reopening the economy, we'll continue to follow that data and see what it's telling us. Again, if it follows our models like we think it will, that number should continue to decrease and put us in a really good place. But remember, after all of the reopening, that doesn't mean we go back to life as normal or pre-COVID. It's going to be a new normal. And so we need to follow all of those social distancing rules, washing hands, wearing masks in public, cleaning surfaces, staying at home if you're sick, calling your physician, taking care of yourself, all of those critical steps to help keep our infection rates low, to keep transmission low, so that we can start moving in a much more deliberative fashion on different things that we can then begin to open up. But it's really dependent upon everybody in the community following those rules and that robust public health response for us to really be able to handle the challenges going forward. And so with that, now I'll be happy to address some of the questions we received from the media.
It has been reported that plasma from recovered COVID-19 individuals is very helpful in reducing the recovery time and alleviating symptoms for hospitalized patients. What is the current volume of plasma donations?
So don't have specific numbers on plasma donations, and so I just wanted to emphasize it's still an investigational drug from the FDA, and so that means we're still collecting data on it. It is showing some promise for particular sets of patients, but it's still under investigation, so still collecting data on it, trying to understand what sort of impact does it have as a therapeutic. But you know, there is some promising data, but we're still continuing to evaluate it.
What efforts have been made to encourage donations?
Yeah, so each of the healthcare systems, as well as the major blood banks within the area, are reaching out to patients that have convalesced from COVID to ask if they can donate blood, donate plasma for this effort.
How many people have received this treatment in the hospitalized population?
So between the 4 different healthcare systems, there's around 100 patients that have received this therapy. And I haven't heard what the outcomes were from any of those, so I can't share that. But just in polling the healthcare systems, the number's around 100.
You told the St. Louis American that a robust response to COVID-19 means focusing resources in the areas where transmission rates are highest. In St. Louis, those areas are nursing homes, North St. Louis County, North City, and parts of South City. You said this response includes ensuring that residents in these areas have access to PPE and to social services that would allow them to isolate and quarantine. If the region doesn't target resources in this way, then you said we increase our chance of transmission. If that is the case, has the task force advised regional leaders about the immediate need to create a stockpile of masks that could be distributed to under-resourced communities when the shelter-in-place orders are lifted?
Yeah, so a couple of different things with that. Absolutely right that those high-risk groups do need more attention, and so there's a couple of different ones that were mentioned. One is any place where populations at risk, so people that are older and have comorbid diseases, where they're living together or being taken care of. So things like long-term care facilities, skilled nursing facilities, assisted living, things like that. And so we have been in discussions with both the providers for long-term care and for assisted living places like that, as well as our public health partners on how can we best marshal resources so that we can quickly identify and help people in those living areas to quickly identify where those infections are coming from. How can we better resource them? So if they need PPE, if they need training, if they need manpower, all of those sorts of things. So those discussions are going on right now. In addition to that, you are right. Some of those communities that are harder hit, such as North St. Louis County and North City, also need some additional resources as well. And so, and particularly for folks that it's not as easy for them to do isolation and quarantine. And so we've been discussing different approaches to that. So whether that is finding some living space for them so that they can isolate and quarantine more appropriately, whether that's in a hotel room or some other place, having a kit or something that they could use at home, which would include personal protective equipment, thermometers, things like that. So if they are able to isolate at home, they can have all of those different materials. And then the wraparound services as well. So, you know, a lot of people that can't afford to take 2 weeks off to be in quarantine, what sort of wraparound services can we provide for those people? So those discussions are going on right now.
Are leaders of social service networks included as core members of the task force?
So remember back when the task force was formed, it was essentially the healthcare services, and really the idea was to work collaboratively with our public health partners, elected officials, our healthcare systems, and FQHCs, the Regional Health Commission, the Integrated Health Network, all of them So the Regional Health Commission and the Integrated Health Network are part of the task force. But we never really meant it to be this ever expansive task force. We really wanted it to be sort of a very deliberative body that can help educate, help inform, help advise, all of those things. Now, with that being said, social services are extremely important. Of course, we're no stranger to them in healthcare, working with them for every day for patients that are discharged from our facilities. And so they are part of the discussion that we have with public health and with all of our other agencies that we work with.
Thank you. That concludes the list of questions received from members of the media prior to and during the briefing. Over the weekend, the task force will provide updates via press release. The next live stream will take place on Monday afternoon. Thank you.